All right, there were some important announcements from the Finance Minister Nirmala Sitharaman on how there are deadlines which have been changed, have been extended. For example, deadlines for the filing of IT returns has been extended. The last date for filing of the March to May GST has been extended. The economic package that has been spoken about is being worked about. An announcement soon. Regulators and the government is monitoring the volatility of the markets. Monitoring of the markets 3 times a day is what the minister is doing. There's nothing to say on fiscal deficits at this stage. We'll have a look at a universal basic income scheme, no minimum balance charges for savings bank accounts, no charges on withdrawals from ATMs for debit card. Aadhaar PAN linking dates have been extended to the 30th of June.
The last date for income tax returns for the financial year 18-19 will be now extended to 30th June 2020, 30 June. For delayed payments made till 30th June, interest rate reduced from 12 to 9%. And this is strictly referring to the financial year 18-19 only.
All right, important measures announced there by the government, but the really big economic scheme yet to come. Dr. Sangita Reddy, Joint Managing Director of the Apollo Hospitals Group and President of FICCI, joins us. Thanks very much, Dr. Reddy, for being with us. The largest scheme announced by the government, we don't know the details of that so far. 15,000 crores is what the Prime Minister said that he would put away funds for. A couple of important measures have been taken by Nirmala Sitharaman. What would you like to see in terms of a comprehensive economic package in this situation? What would you like to see?
So clearly, I think this is just the beginning. The 21-day lockdown is a critical step in terms of breaking the chain and ensuring that the medical aspect or the lives are saved. But now we need to look at livelihoods. We have to look at the unorganized sector, the daily wage earner who is going to be seriously affected by this lockdown. We have to look at their livelihood. Subsequent to that, I think it's important to look at corporates because corporates are the critical link between the economy and the consumer. So how are they going to survive? What is going to happen to MSMEs? And while every corporate does pledge to keep its employees, the fact is, will they have the liquidity to do so? So I think today's announcements, very important announcements from the Finance Minister and subsequently the Prime Minister, are but important steps towards the next requirement, which is the economic package. And in the economic package, very clearly, we need to see a significant budget. We should not worry about the fiscal deficit being breached. We need to see at least 1 to 2% of GDP brought in. There is going to be a slowing down in the economy. GDP rates are going to fall lower than 4%. Towards that, whether it's tax deferment, whether it's interest waivers, whether it's back-ending of all loans and repayment of loans as well as interest to the end of the payment period. Significant and bold moves like this are required as well. And I'm sure we will see some of them coming. For now and today, I think we should appreciate the call by the Prime Minister, understand it's a bold step which will help us break the chain and safeguard the life of the country and look forward to the next step, which is the economic package which is required.
Dr. Reddy, there seemed to be an indicator from the Prime Minister, he didn't spell it out, that whatever funds that were required to shore up our medical defenses, as it were, will be spent, right? Now, what is the priority over there? More ventilators, immediate construction of more hospitals, the training of paramedical staff he also spoke about. Could you spell out urgent funds which are required for the medical side of things?
So I think it's I think it's very important for us to understand that there's a combination of steps. Number one is we need to do more testing. So the scale up of the testing. The second is to create isolation areas because every individual who's infected, tested positive, known to be infected, or even those who are not but suspected to be infected, we need to isolate them so that they also break the chain. The ability to pay for these kind of isolation. There is no time now for us to build beds, but there is an important time for us to scale up beds. So adding ventilators, buying the adequate protective equipment, the PPE, so to speak, so that the healthcare workers, a very important aspect is that in certain countries, the death of the healthcare workers was significantly noted, yet in countries like Singapore, not a single healthcare worker, died because of COVID, and very, very few of them even contracted it. So it's important for us to protect the healthcare worker, scale up the existing beds, find innovative ways to add isolation and supervised medical beds, and strengthen the overall chain, which includes testing. Parallelly, I think India will soon be working on the research required to create a vaccine and to scale up the medicine.
Dr. Reddy, one final question. At this 11th hour, where physically do we buy ventilators from? These are not things which are available off the shelf in the numbers that we require. If ventilators are required in the numbers that may be required in the future, where do we get it from?
So there's a combination of strategies. I think there's a very important factory that manufactures ventilators in Mysore that we know of, which normally does 200 ventilators a month. They've scaled up to 1,000 ventilators. Many healthcare facilities are now scaling down on non-emergency surgeries. So that capacity will come into play to take care of patients. For example, at Apollo hospitals, we are very clear that we will do our very best. We have created a separate location altogether. Our original hospitals will be kept for treating of other emergencies, whether it's the cardiac or the onco and things like that, which don't understand corona. They will continue to come anyway. We have those facilities separate, yet our day surgery centers, which were doing just elective cases, those will be shut down. Those facilities will be created for corona so that those patients are kept separate. But we will step up, we will scale up, we will fight shoulder to shoulder with the government and find ways to handle this crisis and come out of it successfully. By this lockdown, the chain will be broken and the number of cases will definitely come down significantly. And I believe that India will emerge from this crisis relatively unscathed from a medical perspective and from the lives perspective. We now also have to worry about the economy. And that, I think, is the next package or the next announcement and proclamation we will be awaiting from the Finance Minister and from the Prime Minister.
Dr. Reddy, thank you very much for speaking to us. We are also joined at this stage by Vikram Kirloskar, President of the Confederation of Indian Industry. Mr. Kirloskar, 15,000 crores tentatively is what the Prime Minister has put away. Nirmala Sitharaman spoke about certain moves, income tax, GST collection and the like. What would you like to see going forward in terms of funds being made available, and to what target? What should these funds be targeted towards?
I think the funds available should be really, again, for the people who are going to be out of a job right now, okay? And especially in the urban areas, the daily wage earners, the contract labor, the small service people in the restaurant industry, the darshanis. I'm talking of people like that. They're going to be out of a job. They're going to be really the ones who are going to suffer a great amount. Large company employees, maybe even all the people related to large companies, perhaps will be taken care of in a much better way. But these people who have no other livelihood, it's going to be tough. I heard even villages, if they want to go back to their villages, a lot of villages and small towns are saying, please don't come back here, you'll bring the virus here. Stay in your own place. So they have nowhere to go. Let's see how we can look after them first. So whatever funds that are available, can they be given to these people?
All right. And in terms of direct cash transfers, the question which would be asked is, who will get this and how? Should that be the way forward? Do you believe
I think there are many.
Yeah, go ahead.
There are many suggestions that have been made. Different chambers and CI has made some suggestions. I think different people have made different suggestions. Some suggestions have been like people below the income tax line. Some people have said below the poverty line. But perhaps something below the income tax line above the age of 18 is one group. Above the age of 65, who are also may have a problem if they get into a health issue. That's another group. I think both can be looked at.
All right, Mr. Vikram Kirloskar, thank you very much for speaking to us. Lots of proposals, a lot more clarity is required, but at this stage I think it's just a matter of time before that clarity does emerge. I think in light of what the Prime Minister has said, we are fighting something much larger than most people had expected in this country. No one would perhaps have even expected an announcement like this. We'll take a short break, come back with more.